Hello and welcome to the Daily Med. Daily Med, a medicine channel for medicine lovers. Today, in this video, we are going to talk about common cold. Really, this is a winter time, and during this pandemic, if we suffer from cold and cough, it's very scary. We think that, oh God, I have corona. So let us talk about common cold. We are going to talk about what is common cold, why in winters we tend to have more cough and cold, why its incidence increases in winter time, why we have cold and cough, what are the symptoms of it, how it spreads, and at last, what we can do in order to prevent and treat cold and cough. First, we should know why we have common cold. Common cold is mostly a viral infection. In some cases, it can be due to bacteria. Mostly, the most common virus involved is the rhinovirus. But there are other viruses also that can be the reason of your cough and cold. Symptoms of common cold are a blocked or runny nose, sore throat, headache, muscle aches, cough, sneezing, a raised temperature, pressure in your ears and face, loss of taste and smell. Generally, when we have cold or cough, the infection is in the nose or either around it. But if the infection increases, it can spread to our throat or the breathing tubes. So how common cold spreads? Common cold spreads from one person to the another. When a person having cough and cold sneezes or coughs, the droplets get suspended in the air. And when someone else inhales these droplets, the person gets infected. On the other hand, when an infected person, after coughing or sneezing, touches any surface or objects, the secretion gets attached to these surfaces. When another healthy person touches the same surface and then he or she touches their nose or the area around their nose with those same hands, he or she gets infected. But why the cases of cough and cold increases in winter time? In winters, we like to remain close to one another. Mostly, we try to stay at home. Also, one blanket is shared by many members. In winters, we don't wash clothes daily. And even we try to use clothes again and again. That is also a factor in getting infection. It is seen in winters. People close their fan and windows. And because of the poor airflow within our rooms, the virus gets suspended in our room air for a longer period of time, thereby increasing our chance of getting infected. In winters, the blood vessels around our nose gets constricted or narrowed, because of which there is a very less blood supply supplying our nose. Because of this lack of blood supply, there is no warmness around our nose and thereby low defense and immunity against the viral attack. In winters, there is less sunshine, because of which we have less vitamin D production inside our body. Vitamin D is an immunity booster. If this is less in our body will not be able to fight against the viral attack. So, what we can do in order to prevent ourselves from getting infected? First thing that we should keep in our mind is to keep distance from the infected person. Also, try to be away from crowded places. Try to get sunlight and be in open air. At least open windows for some time for the fresh air to get in. Try to wash your hands again and again. Use face masks, especially in crowded places and when you are near an infected person. Try to wear warm clothes, as not wearing proper clothes will lead to the constriction of the blood vessels, thereby making our body less protective. Try to wash your clothes daily and do not wear single cloth for days. Keep your blanket and quilts clean. Try not to share your blankets with others. So how we can treat our coughs and cold? If you already got it. Most common cold ranges from some days to weeks. If the patient is suffering from more severe symptoms, he or she can take symptomatic treatment like for fever you can take antipyretics, for sore throat you can take anti-allergics, for cough you can take cough syrups, for stuffy and running nose you can take nasal drops or nasal sprays on your doctor's prescription. If your doctor finds your test results to be of bacterial infection, the doctor can also prescribe antibiotics for the treatment. DailyMed would like you to take note of all these symptoms and be safe. If you like this video, hit the like button. If you want to know more facts about human life, please subscribe to DailyMed. Also, comment down if you have any queries and questions. Don't forget to press the bell icon to get notifications of our updated contents. Also, don't forget to follow DailyMed on Facebook. Thanks for watching DailyMed.